Hello everybody, back with another video today, which I'll title The Good, the Bad, and the Ugly of COVID-19 after 12 months or a year of this pandemic. So we're going to start off with the good news, then we're going to move on to the bad, and we're going to finish it up with the ugly of what some people don't want to let go and to what point they want to go. So let's start off with the good news. So as reported in the Washington Examiner, COVID-19 cases plunging too quickly to be credited to vaccine rollout by David Hodgeberg, healthcare reporter. So he says, COVID-19 cases and hospitalizations have dropped dramatically, but epidemiologists say it is probably too early for the coronavirus vaccines to be making the difference. On January 8th, new daily cases of COVID-19 reached an all-time high of 295,121. The 7-day average was about 243,538. On Monday, the 7-day average had fallen to 87,073. The number of patients hospitalized with the disease peaked on January 6th, while the number of those intensive care units reached a high 2 days later. Since then, hospitalizations have dropped 51%, and ICU hospitalizations have fallen 42%. Yet, it seems unlikely the improvement is due to vaccine campaign. So because that the decline, like I've been reporting to you guys for months now, that this virus seems to be always following a pattern. So it, like I've said before, it goes up for a certain number of weeks, it stabilizes for a certain number of weeks, and then it starts going down. No matter of the lockdown measures, no matter of anything. And like he says in this article, the vaccine rollout only started in December. So it cannot be because of this that after January, what he says over here, so as the peak of January 8th, and then it starts going down in decline since then. Even if it's small decline at the beginning, but we can see the difference 6 weeks later. So it seems like the virus is following this pattern everywhere. We're not talking about the number of cases, the difference in number of cases. We're talking about how it goes up, stabilizes, and goes down. The pattern seems the same all across the world with different time frames. So I'll continue. I don't think that what we're seeing is a vaccine effect yet, said Dr. George Benjamin, Executive Director of the American Public Health Association. The reason is that if you look at how much vaccines we've delivered, it is much too early. So basically, this article shows you how vaccines had already started to dip. That the virus had already, the outbreak had already started to dip as they were starting the vaccine rollout. So to show you that this is not just in the States, this is everywhere, let me show you over here in our numbers here in Quebec. So if we go to, and this is on ici radiocanada.ca, you go COVID temps réel, and you'll find all this information. So January 1st, we had 1,117 hospitalizations and 167 intensive care unit beds being used. As of today, 689 hospitalizations and 117 people in intensive care. So remember a few weeks ago when they were using the excuse that the hospitals were that the hospitals were overcapacity, sorry. Well, now they can't use that no more because we obviously can see the numbers with 689 people in hospital across the province and 117 in intensive care. We obviously can't say that it's the hospitalizations that are the problem right now. Maybe a few weeks ago, but not right now. So that's some good news that hospitalizations and intensive care have been dropping, even though a bit only each day. But if you put everything together, they have dropped significantly in the last 6 weeks. So this is Quebec numbers. Now let's go to the Atlantic article written on February 17th. Okay, COVID-19 cases are dropping fast. Why? So it goes on to say, might be behavior. Many Americans finally got the hang of the masks and social distancing thing, which I don't see the correlation there. But where I, in my humble opinion, I think it's more the second reason that they put out. Seasonality. The coronavirus was perhaps destined to decline this time of year. Behavior can't explain everything. Mask wearing, social distancing, and other virus mitigating habits vary among states and countries. But COVID-19 is in retreat across North America and Europe. Since January 1st, daily cases are down 70% in the United Kingdom, 50% in Canada, and 30% in Portugal. This raises the possibility that Sars-Cov-2, the virus that causes COVID-19, is seasonal. It's another proof of what I've been saying for the past months. Excuse me. Last year, a meta-study of coronavirus such as SARS-CoV-2 found that they typically peak in the northern hemisphere during the winter, with the most common peak months being January and February. The apparent seasonality of human coronaviruses across the globe suggests that this phenomenon might be meant to produce improved understanding of transmission of COVID-19, the authors concluded. The notion of seasonality is both obvious and mysterious. We know that many respiratory viruses are less virulent in the summer, accelerate in the closing months of the calendar year, and then recede as the days grow longer after December. But as the Harvard epidemiologist Michael Mina told New York Magazine, we don't fully appreciate or understand why seasonality works. So they don't know why it's going in this pattern of more of a seasonality virus, but they have found out that is the case. Though we have the proof from this virus has hit enough countries around the world that we can examine its pattern, and the proof is in the pudding, like they say. It's there in the numbers. Okay, so this is the Atlantic article. Here is to show you how the cases have been going down across the globe. It's not because of the vaccine, and it's more because of a seasonality of, effect of the SARS-CoV-2 virus. So if we put all this together, the first part of this video, these articles that I have read for you, we see that it's because the cases are going down and they can't use hospitalizations no more as an excuse for continued lockdown measures. They're starting to figure out that the virus spreads and comes and goes with the seasons, that we must learn how to live with this virus. I know it seems like I keep repeating myself, but I find it very important that we realize that this virus will stay among us for years to come. And we cannot stay with these measures because we have experts, whether it be doctors, pediatrics, sports experts, saying that not only do we need to reopen for our businesses to survive, but our young generation needs to socialize and get back to their activities, because they're probably the biggest collateral damage from this pandemic and from the lockdown measures. But I digress. Let's continue with some of the good news. So here, a professor from Johns Hopkins University called Marty Makary, hope I'm pronouncing that right. He is also, before I make a mistake, let me give you his exact credentials, okay? So Dr. Makary is a professor at Johns Hopkins School of Medicine and Bloomberg School of Public Health, chief medical advisor to Sesame Care, and the author of The Price We Pay. And what is his good news that he says? Well, he says we'll have herd immunity by April. Okay, and to put everything into context, this article, he's speaking about the United States. But we can generalize that maybe the United States, because in some sectors have had less measures, So the natural herd immunity might be greater than here in Canada or in Quebec. But it's just to give you a picture of that we might be going in the good direction towards herd immunity. So amid the dire COVID warnings, one crucial fact has been largely ignored. Cases are down 77% over the past 6 weeks. If medication slashed cases by 77%, we'd call it a miracle pill. Why is the number of cases plummeting much faster than experts predicted? In large part, because natural immunity from prior infection is far more common than can be measured by testing. Testing has been capturing only from 10 to 25% of infections, depending on when during the pandemic someone got the virus. Applying a time-weighted case capture, average of 1 in 6.5 to the cumulative 28 million confirmed cases would mean about 55% of Americans have natural immunity. Now add people getting vaccinated. As of this week, 15% of Americans has received the vaccine, and the figure is rising fast. Former Food and Drug Commissioner Scott Gottlieb estimates 250 million doses will have been delivered to some 150 million people by the end of March. There is reason to think the country is racing toward an extremely low level of infection. As more people have been infected, most of whom have mild or no symptoms, there are fewer Americans left to be infected. At the current trajectory, I expect COVID will be mostly gone by April, allowing Americans to resume normal life. So this is an expert from Johns Hopkins University, which is the go-to place for COVID-19 in the United States. They're the ones who track the numbers, the cases, they're the ones doing the studies. So this is not just any jabroni talking on the internet. Okay? Another good news, before I go on to the bad. So, from Bloomberg, Pfizer biotech shot stops COVID spread. Israeli study shows. The Pfizer Inc. and Biotech SE COVID-19 vaccine appeared to stop the vast majority of recipients in Israel becoming infected, providing the first real-world indication that the immunization will curb transmission of the coronavirus. The vaccine, which is being rolled out in the National Immunization Program that began December 20th, was 89.4% effective at preventing laboratory-confirmed infections. According to a copy of a draft publication that was posted on Twitter and confirmed by a person familiar with the work, the companies worked with Israel's health ministry on the preliminary observational analysis, which wasn't peer-reviewed. Some scientists disputed its accuracy. So, Israel here is the country that has vaccinated the biggest proportion of their population to date yet. So they have the data to look into these things. So I think it's good news. Are we sure of it at 100%? No, we're not. Further studies or further research has to be made to be, well, we can never be 100% sure, but to be more certain, we can say. So that's good news. So to recap the good news, we have cases have been declining for 6 weeks, whether it's in the States, Europe, globally, here in Quebec. I've shown you that. We have in the Atlantic article where it shows you how it can't be because of the vaccine, that we see that it's more of a seasonal transmission. Outbreak goes more with the seasons. We've shown you the progress and the good news in the vaccine in Israel, and with the vaccine in Israel, and with the Wall Street Journal article, saying that the experts saying that we might go back, the United States might go back to normal in April. So now let's go into the bad. So we've seen that, at least what I find bad, our Premier Legault, when it comes to COVID, has been constantly lying to us. Last week, he looked inside the camera during looked straight into the camera at a press conference and said that there was an explosion and outbreak after Christmas. Well, if you go to every site that has these statistics, whether it's the government of Quebec site or whether it's the Radio-Canada Temps Réel COVID update site, you see that it's totally false. Totally false. He also said that his decisions are based on recommendations from public health. Well, in this article, in TVA Nouvelle, we see that that's total BS also. Because we see that public health in Canada had not recommended the closure of restaurants, malls, and during the first outbreak in March, during the first lockdown. So he had recommended that restaurants stay open with 50% capacity. He also had recommended that people avoid malls unless they really had to. He did ask for the closure of bars, clubs, and buffets, and the sugar shacks type restaurants. Museums, the closure of museums, libraries, culture places, theaters, community centers, movies, arcades. The closing of schools, spas, saunas, and gyms. He also said last fall, more recently, that if it was only up to the public health director, Dr. Arruda, the gyms, restaurants, movies, and theaters would have stayed open in the October 1st lockdown. So we see here that the premier, keeps on lying to us, saying that it's not his decision, but the public health recommendations that he's following. Well, now we see that that's just a lie. Okay? Also, in something else, he suddenly, on Friday night, in the middle of the night, you see here circled, February 19, 2021, he completely changed the characteristics needed to pass to the green zone and what the green zone brings in restrictions. Well, now he added that some basic measures will stay in place even when we go to green. So, like basically physical distancing, cleaning of hands, specific measures with that you could to certain activities that you could apply to certain activities. Basically, they will still continue. You will still have to continue avoiding social contact. Basically, you can't have gatherings, family gatherings, or friend gatherings, or weddings, or anything, even in the green zone. So that was changed because before that was not the case. So now we see that they're preparing for a continuous lockdown by changing the rules, by moving the goalposts as we go. It's like a ref in the middle of a game changing the rules. That's exactly what he's doing. Okay? Oh, and I would like to show you this little, before I continue. Here, 15th of June, hospitalizations were 718. 19th of February, 700. Where now they even have dropped a bit more. Okay? The outbreaks were going down. Restaurants were open, now they're closed. Sports were open, now they're closed. People seemed optimistic, now people are losing their brains. So, now they're using what to push fear? Well, it's the new variants they're saying, right? So let's go into the ugly part, because we know that the bad part is that the premier has been lying to us, and that they're changing the rules of the game as they go along. So now the ugly part is the fear mongering. Okay? So here, reported in CTV News, race against time, third wave of COVID-19 feared as wildcard variants spread. Wildcard variants. Fears are mounting that Canada could see a third wave of COVID-19 infections in the coming weeks as variants of the novel coronavirus spread even to remote regions of the country. So I'm not going to read their propaganda here. It's just to show you how they're moving towards scaring the population and making them accept, basically, the continuous lockdowns that are about to come. How dangerous can it get? Well, some people are even pushing zero COVID cases for these measures to continue until there is zero COVID cases, which will never happen. Will never happen. That's been proven. No early end to COVID-19. A new strain in any nation threatens us all. So basically, if there's a case in any nation at all, then we're threatened. So if there's a case in China, then we must continue our lockdowns here in North America. Was the logic in that? Absolutely none. Once again, I'm not going to give them the pleasure of me reading this propaganda. It's just to show you where this pattern leads from fear to continuous lockdowns. Even in Vox tweeted their article, recent developments in the COVID-19 pandemic have exposed a grim reality. If people keep doing what they're doing now to prevent infections, the US is screwed. What the new COVID-19 variants mean for changing our daily life. Still going to the grocery store, they say? With new virus variants spreading, it's probably time to stop. So don't go get food. Don't go pick up water for yourself. We see what's happened in Texas, where they're losing power. And some people didn't have backups, so didn't have to go get backups of food, of water, and these things. And now they're in a very precarious situation. And now basically what Vox is telling you to do is to not go to the grocery store. Stay home, stay closed in your home, where it's proven that that's where the virus spreads, is indoors, inside your home. So guys, this is to show you how even though there is good news about the virus and its spread, that it's declining across the globe, in some cases by almost 80%. But yet some people that love the control that this pandemic is giving them want continuous lockdowns. Dr. Fauci even said that there will maybe certain measures will have to continue into late 2022. I've heard even some crazy people say 2023 when it comes to Canada because of the slow rollout of vaccination caused by the incompetent Justin Trudeau. So guys, even though there's all this good news, like I just said, it doesn't look like we'll be coming out of these lockdown measures anytime soon. Unless, of course, we start standing up and fighting for our rights. It's very important. Because after almost a year of this virus, of this pandemic, even though we have the data to adapt to the spread of this virus, we decide to use useless measures of lockdown, of people losing their businesses, of people going, I don't want to use the word insane, but having problems, issues with their mental health because of this pandemic. So I ask you, after how many months will you open your eyes and stand up? Well, now we're after 12 months. Is it after 24 months? 2 years? 3 years? I asked the question. All right, guys, thanks for tuning in. Hope to see you next time.